COVID-19 pandemic shook the era of modern medicine globally. It is characterized by its varied clinical presentation, ranging from asymptomatic to severe symptomatic disease with dyspnoea, hypoxia, and even multiple organ failure. The body's response to the invading pathogen is quite heterogeneous. Hence, there should be measures that one can take to prevent this disease severity. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and I am going to talk about ways to predict the severity of COVID-19. Inflammatory responses in COVID-19 is responsible for acute respiratory distress syndrome and multiple organ failure and plays a major role in the morbidity and mortality of patients. A present study in the Journal of the Associations of Physicians of India assessed the serum levels of cytokines and its association with other inflammatory markers, as well as studied this association with the disease severity in COVID-19 and hence their prognostic significance. This was a retrospective observational study of 175 admitted COVID-19 patients. The patients' clinical data, lab investigations, inflammatory markers, as well as the serum levels of cytokines were all extracted. All the patients were divided into three groups. Group A had asymptomatic patients, Group B were divided into mild to moderately ill patients, and Group C had severe or critically ill patients. It was found that 55% of the patients were asymptomatic, 24% had mild to moderate illness, while the remaining 21% had severe or critical illness. Fever, cough, dyspnea, and comorbidities including hypertension and diabetes were very common in Group C. The absolute lymphocyte count, lymphocyte monocyte ratio also showed a decreasing trend, whereas the absolute neutrophil count and the neutrophil lymphocyte ratio, platelet lymphocyte ratio, and the eosinophil lymphocyte ratio showed an increasing trend with an increase in the disease severity. Also, the serum interleukin 6 was found to be significantly higher in Group C as compared to Groups A and B. Hence, the researchers concluded that the elevated IL-6 levels led to adverse clinical effects, so IL-6 level might serve as a potential prognostic marker for the severity of disease in COVID-19. Inhibition of this IL-6 marker might be helpful to prevent serious adverse events in COVID-19 infections. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.